Working as an associate in dentistry allowed me to focus on my clinical skills, which is what I really enjoy, to focus on building my brand. The treatment that I do the most of and the treatment that I enjoy most is porcelain veneers. And I've done over 14,000 veneers in my career, and I want to do beautiful handmade veneers. You need to be able to charge a certain fee for them, and also to build my brand using social media so that I could attract the kind of clients that were looking for someone that could provide clinical excellence. But as a dentist, you're not taught the business of dentistry. We're prepared with clinical skills, but we don't learn the business.
Welcome to another episode of the Dental Dialogue. As you can see, we're in person. This is the first in-person podcast that we have, and we have the lovely guest, Dr. Marina Rode. Thank you very much for inviting us in here.
Lovely you guys could make it from all over the world.
Awesome.
Yeah, just to tell everyone who's just tuning in, we are right now in London.
Yeah.
In Kensington.
And you're normally here. You flew in for it. Yeah. Okay. Yeah.
I flew in as well. I mean, I haven't been to London back the past 2 years. It's been a long time.
Where have you been?
All over the place.
Oh, wow. Amazing. I want your guys' lives.
Yeah, it's a pleasure. I mean, for us to be here and to talk about just the profession, the dental profession, all the things that come with running a dental practice, and to just hear from your side what you would say about it. Your clinical side of it, winning patients, bringing them great results to make the patients happy, and to just talk about also your social media, which is quite big. You are also on many podcasts, and I would say we would love to hear just a small introduction, very shortly, how you came into the dental field.
Into the dental field?
Yes.
So when I was at school, I wanted to be an actress. And
it's the same. I wanted to be an actress.
Yeah, okay, cool. Actually, there's a lot of us, dentist, actors. Yeah, I think there's something there. So I was doing A-levels to get me ready to do theatre studies at university. Mm-hmm. And my headmistress, I was at a grammar school, so our headmistress took like a real interest in all the students, and she was like, "Oh, you're very good at science and you're very good at art, and did you know you could combine the two in dentistry?" And at the time, I was like, "I'm going to be a famous actress. Why would I want to be a dentist? Dentistry's not happening." But she encouraged me to do some work experience and go and see how I felt in a dental practice, it was great. It was a great experience, and I was like, wow, I could really see myself doing this. So I went back to school the following week, and I changed my A-levels to maths, chemistry, and biology to allow me to then apply to dental school. And so I guess that changed the whole course of my career, because then I became a dentist.
Yeah, that's great. I think that's not the usual path.
No.
Especially not with the arts kind of side. I mean, I definitely agree. It was kind of the same thing for me.
Yeah?
Yes, I always loved arts, to just also do let's say, craftsmanships and more filigrane, can you say that?
More like
detailed
fine
work.
Detailed, yeah.
Yeah, and but how would you say was your time starting your first practice?
Oh yeah, so working as an associate in dentistry is great. It allowed me to focus on my clinical skills, which is what I really enjoy, and to focus on building my brand, which is really important. So the treatment that I do the most of and the treatment that I enjoy most is porcelain veneers, and I've done over 14,000 veneers in my career, and it's something I really enjoy. But I don't want to do cheap, ugly veneers. I want to do beautiful handmade veneers made by a master ceramist, and that means that you need to be able to charge a certain fee for them, because the whole expense involved in creating something like that is pretty huge. So it gave me an opportunity, working as an associate, to firstly work on my clinical skills so that I could provide the sort of smile makeovers that I wanted to, these excellent smile, beautiful, natural smile makeovers that weren't these blocky chiclet teeth that were coming out all over the place at the time, and also to build my brand using social media so that, and various other avenues, so that I could attract the kind of clients that were looking for someone that could provide clinical excellence and those natural results, and were prepared to pay the fees that I needed to charge to achieve that. So I used my time as an associate to accomplish all of that. And then when I felt like it was time, like, okay, I've got that, I've got my clients coming in from all over the world from my social media channels, you know, I can prep 10 veneers with my eyes closed and I know that they'll be perfect, minimal prep veneers and getting perfect results every time. Then it was about moving on from being an associate to being a practice owner, and creating an environment that was then my dream environment that would support that journey for my patients. So they not only were they getting a 5-star service, not only were they getting a perfect smile makeover with perfect results every time, they were also getting a perfect experience with where they were sitting and you know the way that they were offered their coffee and the team that was looking after them. Yeah, it's an experience, you know. My surgery is all voice activated. You know, we have the latest equipment, that if there's equipment out there that I believe is innovative within dentistry, then we have it here at DRMR. So it allowed me to be able to then provide that experience to support my clinical work.
Yeah.
That is
and
great.
you can see how innovative everything is here, and also how good your service is. And I mean, you've been a dentist over the year, you can see through your website, through your social media, that you do a really good work. But I can't imagine it must have been easy for you, regardless of how well prepared you were as an associate to start your own practice. How was that for you?
Oh yeah, it's like one of those life experiences. Like, you know, people say like death, the death of the family, buying a new house, divorce, marriage, or, you know, all these life events that happen that really change your life. I would include setting up your own dental clinic along with or having a baby, like all those things. And I would include opening a dental clinic alongside those. And also, as a dentist, you're not taught the business of dentistry. Like, you know, we're prepared with clinical skills, and then we go on all these courses to build on those when we graduate, but we don't learn the business. So it was completely like, whoa, like so much learning to do every single step of the way, and it's all quite overwhelming, and it's all like, it's very intense. And you know, those first 6 months of any principal's life, I don't think there's anyone you'll speak to that won't be like, wow, I was knocked for 6. Like it really knocks you. You have to be prepared to give your life to this place for at least 6 months, 6 months of your life. And then I think after 6 months it started to I was like, okay, I've got this now, I get it. And then it got a little bit easier, but for the first year it was still super intense. And then it was something happened at the 1-year anniversary when I was like, okay, now I get it. Now I can have my dreams back. Like, you know, I lost my dreams for at least 6 months and up to a year. Where,
figuratively, or
I actually literally lost my dream. I've always been this wonderful sleeper, and I dream about like holidays and being at the sea and like beautiful things, and I love sleeping because I have this wonderful time at night on these
exactly the same. Sleep is one of the most important things for me.
Like these great adventures that that I was on that you know, I just want to stay in and enjoy. But suddenly I dreamt about the clinic every night. And I problem solved about the clinic every night, and so I worked all night, and it was like a lucid dreaming where I would go in and I'd be like, okay, I need to organize this, I need to do this, and plan it all in my head. And I'd wake up and be like, oh, okay, that's all planned, let me write that down somewhere. So I lost my adventures, you know. And then literally, I think it was about a year, then suddenly I had a normal dream again, and I was like, oh wow, I hadn't had this for a year. That's nice. My dreams are coming back. So I still lucid dream. I still do it every so often. Like when it's very busy here, really, like it's intense, I'll have a night of planning things and organizing. But it's rare rather than every night now. But initially it was every night. Yeah.
Oh, wow. Okay. That sounds.
Because that's like,
it's intense.
It's your new baby, basically.
It's a baby.
You have to start and build up from scratch.
And if you ask people if they think it's easier to open a clinic or to look after a newborn baby, a lot of them will say it's, you know, having a baby is easier.
Really? So people who've done both.
Yeah, exactly. Yeah.
Wow.
Yeah. It's pretty intense.
Yeah.
Wow. And
how would you say social media helped you in that whole journey? I mean, why in the first place also did you started it? Because we know still dentists, they don't want really to look into it. Many of them.
Especially here in England.
Yes, and every industry has started now. Every industry. I mean, the most outrageous businesses use that now. And we would like to know how that came about.
Yeah, so I think when people say, oh, if Instagram closed down tomorrow, then, oh, you know, how would that impact your life? And, you know, people make out like, oh, you know, it's a funny thing to say. But I'm literally like, if Instagram closed down tomorrow, you know, how would it impact my life? Like, it could close down my business. It's this whole clinic, I paid for this building this clinic, and I pretty much paid for it on the clients that I get from Instagram. So wow. Instagram's been such a valuable asset for me to create, like I was saying, those clients, find those clients who come from all over the world for the sort of treatments that I want to offer. So they're looking for natural porcelain veneers with one of the top dentists who's very experienced, who's going to give them the results that they want. And they look online, and they look on, you know, that age category. Quite a lot of them are on Instagram. So let's say if it's, you know, between 35 to 45-year-old people who can afford that sort of smile makeover and want that sort of result for themselves, and you know, they're on Instagram, and so they go on there and they do their research, and then they find me. They get to know me. They get to see my clinic. They get to see my work, and they find, you know, they know everything about me. Yeah. So by the time they've come in, they already know they want 10 or 20 veneers. They've already chosen they want me to do it, and it's just a matter of me going ahead and doing that work for them. So Instagram is super valuable for us as a cosmetic dentist and here at DRMR. But I'm on all the platforms. So, you know, I've started building up my LinkedIn only really in the last 18 months or so, but already, you know, got like 10,500 followers. I'm amazed that so many people on LinkedIn are interested in the little bits that I have to say, and obviously on Instagram there's 42,000 on my dental page, and I think like 12 or 14,000 on my personal page, and there's a lot of people out there just watching all the time the content that's coming out. I got into posting on social media probably because of my acting background. You know, like that's in me anyway. It's really comfortable for us to pick up a camera and talk to it and perform, because we're not shy of that. Like, you know, if you reached out to me and said, oh, can I speak to you about a podcast, it's like, sure. It's not, there's no part of me that's anxious about doing this with you today, because that's not something that's within me. Maybe for a lot of dentists it is. Maybe they don't have that kind of intrinsic confidence to be able to do that, and so it's something they need to work on and so that's why it's not such an organic thing. And I was around, you know, in 2011 when Instagram came about, and that's when I joined Instagram. You know, it was brand new, and that's when I built my personal page, and then started posting on there. And then over the years, you know, every so often I post about teeth, and when I posted about teeth, then people would message me and be like, oh, can I come and see you for dentistry? And I was like, this is interesting. Instagram for business didn't exist back then in 2011. Even for the few, you know, the next maybe 5 years after that, it really didn't exist. And then I thought, okay, well, is this okay? Let me contact the General Dental Council, who's our governing body in the UK.
Well, you actually went to see whether it's actually all right to do so.
Well, because I had pictures of me in a bikini, and then me drinking, and then me being a dentist, and then I was like, you know, because it was my personal page, and so it was like, is this okay? Is there going to be a repercussion for this? And the General Dental Council at the time said, oh, we don't have a policy on it. They do have a policy on it now. They didn't have a policy back then, and they were like, but probably that's not a good idea. You should create a dental page. And I was like, oh, how boring. Who's going to follow a dental page? You know, my life page is fun, and that's, you know, what am I wearing? Where am I going? Where am I on holiday? I get that people want to see that because it's a magazine of my life. What am I going to do with a dental page? But I was like, okay, so I was one of the first people to do that because Instagram for business didn't exist. But I created Dr. Marina Road as an Instagram page, and slowly it grew, and actually now that's my favorite page. And you know, Marina R is like, okay, fine, it's there, and I'll tell you about what I did at the weekend. But Dr. Marina Road, you know, I love going on there and showing what we're doing at work and showcasing what's happening at my clinic and showcasing the work that I'm doing. And I love how excited patients from all over the world and clinicians from all over the world get to see the work that we're doing here.
Fantastic. And I can see that your acting background has helped a lot, especially in the social media part. But I mean, we speak with a lot of dentists who are struggling like a lot with social media, and they're not bringing in as many patients as you are. What do you think it is, apart from, of course, the lovely work that you do, and or maybe that might be it, also your experience with acting, what are some nuggets that you maybe think has helped push the needle in terms of getting patients in relatively quickly when you started your practice itself?
Yeah, so I always say to people, it's really important to talk about things that you're passionate about. Maybe for all dentists, that might not be dentistry. You know, general dentists, maybe they don't feel like they can talk passionately about changing a silver filling. You know, and if they can't, then I don't think that needs to be what your page is about. I think if your passion is cycling, or your passion is cooking, or whatever it is that your passion is, you should create a page around that. And if you don't love showing your own face, and you're one of those people that feel self-conscious, like, oh, you know, you have, you know, self-limiting beliefs that that's not good enough, I don't want to post it, you know, whatever, then maybe don't post your face. Maybe start off by posting your bike, or a route that you're doing, or, you know, what you cooked today and the recipe that was, you know, and filming the table rather than filming yourself. And there's so many options now on Instagram with Reels where you can do a voiceover, or you can use this robot voice to talk for you, and then through that create a following, because your tribe will follow you when they feel your passion, and then your tribe will come to you for dentistry, because people don't know if you're a good dentist, but they know if they like you, and if they like you, they will come to you. So if you start doing a page, you know, about food and your recipes and the things that you're cooking, and then you're also like, oh, I'm a dentist, oh, I'm going to it, oh, actually as a dentist, oh, this acid's not good, then just organically by yourself, you'll start building a tribe towards that. So that's one angle to do with it. If the question is, why is my page successful, it probably is because I do show my face, and so my followers can relate to me, and because I give insights on my daily life, day to day, I think they feel quite involved in my life, and you know, they comment on it, and you know, they'll message me, oh, you're doing that, oh, you're going there, oh, what happened with this, you know, they're kind of interested. It's like the Marina show where like
yeah, a little bit,
oh yeah, what happened with that, why have you not posted about it, you know, and so then that's a really good way to get them to be coming back, and also so I think posting comfortably, like being able to grab your phone and just grab a story and not overthinking it, but just saying what it is that you've just done, which maybe you think isn't interesting to other people, but maybe it is. It probably is, because we're like that. We love reality TV. Is why I think my page is so successful. And there's courses that you can go on for that. You know, you can go on media training courses that teach you specifically that okay, let's practice. Okay, let's write a script. Okay, look at the camera. Okay, say it. Talk to the camera as if you're talking to one person. Don't think how many people there are. Think of one person. Think of them in your mind. You're talking to that person. Tell them about the filling you've just done. Tell them about the night guard that you've just done. And then that kind of, you know, makes that easier for you. So I think, talk about something passionate, build up to being able to show your own self and your own personality on camera. And probably the most important thing to build a social media following is consistency. Because it doesn't matter if you post stuff that's not very good, but if you're consistent, you'll have followers that keep coming back. If they see that you're only posting once a month, they'll just unfollow you because they can't be bothered. They're like, oh, this person's not dedicated to sharing content with me, so I'm not going to be dedicated enough to waste one of my followers on them.
I see that in my own life. Like when I scroll past Instagram and I see somebody that I don't recognize on my account, but I recognize the person. I was like, oh, this person hasn't posted in a while.
Yeah.
I forgot about them. I might as well just get rid of them.
Yeah, or they even then go on their page, oh, they're really not posting anymore. Yeah, forget it. Why am I wasting my time? And also, you know, the amount of times I see people and they're just like, oh, you're on my phone every day. And so that's just reminding them, right? Like one of your patients sees you on their phone every day on their way to work, and then they go to work and one of their colleagues says, oh, I chipped my tooth. And they're like, oh, I know a great dentist.
Yeah,
and then how easy for them to refer you by saying, here's her Instagram profile, and they can just go straight on and book in. You know, they can see you, they can see your work, they can see they like you, they can see where you are, and they can book their appointment with you. You know, I had someone message me the other day to say they were in a pub in the outskirts of England, outside of London, and there was a table of ladies sat next to them in the pub, and the lady was like, do you know my dentist? She's Dr. Marina Road. She's amazing. And she grabbed her phone and she opened my Instagram and she showed it to all the women on her table, and the guy was like, these women next to me are showing each other your Instagram, and then, you know, that's it. Then all 5 of them follow you, and then they're like, oh, I should go and see her.
That's also the reason why we are here today.
Yeah.
It is because
exactly. Socials.
It's networking, and it's also attention. It's so important. Back then it was more about location with the dental practices. You needed the perfect location. Now you can really go anywhere.
Yeah, you can be anywhere. I can be anywhere.
Yeah, 100%. As long as your socials, I mean, website is also good, but I definitely believe that even the socials are more important than the websites nowadays.
Probably,
especially when it comes to like veneer work as well, like where
Yeah.
it's super aesthetic, people want to see.
Yeah.
And that's what you guys have as well on your Instagram, where you have the patient testimonials, where
Yeah.
people can see the befores and afters really well.
Yeah.
And they can just kind of like envision themselves in there, like, this is how my teeth will look like
Yeah.
afterwards.
Yeah.
Yeah.
I think it's really important to, if you want to work at this level and you want to place yourself as the expert, you have to be really good on every platform. So if your Instagram's amazing but your website's rubbish, then they're going to be like, she hasn't got attention to detail. Like, look at her, she can't even bother to have a nice website. So it needs to be congruent. Like, the clinic needs to look like that, the website, the socials you need to look like that, everything needs to look like that. And if there's something that's not quite right there, then it's like, that doesn't feel comfortable anymore. Actually, I'm looking for the very best, and I don't think she is. So
100%.
yeah.
Great. I think that brings us to the end of this podcast episode. It was really detailed and
Short and sweet, I would say.
yeah, yeah, good insight. And yeah, we are so happy that we could come around. And for everyone else, if you enjoy this type of content and you want to see other professionals just giving tips, tricks on how to start your practice, how to run it, how to get more patients, don't forget to subscribe, and see you guys in the next episode.
Oh yeah, and all of Dr. Marina's Instagrams and everything will be down in the description below. If you're ever in London and you need to get what kind of work done, what can they do over here?
Well, they're dentists, so if you need help with your making your smile more beautiful, I'd love to help you. But if you're a dentist, actually, maybe my academy is more interesting to you. I run face-to-face courses, teaching dentists how to do porcelain veneers. They come from all over the world to learn, and I have a mentorship program, which also I have dentists from all over the world that are part of, where I mentor dentists on a daily basis to be better cosmetic dentists, and I have a series of online courses as well, all within the academy. So maybe that's useful.
100%.
Fantastic.
Thank you so much.
Thank you.
Thank you.